Helen and I will discuss a little bit around some of the pituitary conditions, but before we go into some specific conditions, it is helpful to know what normal looks like. So I'm assuming that you have your children or know of relatives or loved ones with pituitary problems, or you might be worrying they have a pituitary problem. So it's helpful to know for the context what is normal. And when we talk about the pituitary gland, the most important function or the biggest thing that we see as an endocrinologist is growth. Okay, so we pay a lot of attention to how children grow. This is a growth chart, as you will see, that children grow along a certain line, and they may be on the lower lines, they may be in the middle lines or top lines. These measurements in the red dots that I show you are individual measurements how children grow. The one on the right side, the arrow, indicates how children grow for their parent heights. So if you think about it, children's heights are similar to their parents. Okay, so you would expect somebody whose parents are of an average height, as here in this graph, that their child will also be of an average height. If your parents were short, just they come from a short family, then it is natural to expect your children to be on the short side. But we do look at these graphs in great detail and try and work out, is the child growing well or is the child not growing well? That becomes important. And so it's important for you as parents to know whether your children are growing on the growth chart. So when you go to clinic consultations, ask, is my child growing well? What centile and how does that relate to my own height? Okay. So I was saying that height depends a lot on your parents' heights, and it's quite a substantial number. That's about 75 to 85%. Um, in the first couple of years, growth is dependent not so much on the pituitary gland, but actually on nutrition. So if your child is fed well, child will grow. If the child isn't fed well, then growth may drop down. But after 2 years, growth hormone becomes important. And this is also important if children have growth hormone deficiency. And this is maybe you can relate to somebody that the growth starts to fall off third, fourth, fifth years. So that's something to bear in mind, that growth hormone deficiency typically comes to us when they're just about past the toddler age. Just a little bit about what is the pituitary gland. So here is the pituitary gland. This is a brain scan, and the gland is here. As you can see, the front part, by the way, these are the eyes, that's the nose. So you can see that the front part of the pituitary gland looks a bit gray. The back part is a little white, and it's hanging, if you can see closely, by a stalk. It's like a pendulum, okay? But it's such a small gland, but it makes such important hormones. And of the many hormones that this gland makes, the most amount of hormone that it makes is growth hormone. So that is one reason why we look at the growth in great detail. Okay, just is helpful to be aware that there is not just the pituitary, there is an area of the brain which sits above the pituitary gland, and that's called the hypothalamus. So your doctor will probably talk about hypothalamic defects. It means that the hypothalamus is the part of the brain that actually sits above it and controls the pituitary gland. And together they control a number of hormones. Okay. So important to recognize that children grow. Adults, you and I, don't grow, but growth is a really important marker of general well-being and of the pituitary hormones working well. If you're not happy when we talk about the growth chart, then it is important for you to understand that the child is growing as per the lines they should be. This is a graph which shows that, as you can see, the child was growing along the lower lines in early childhood, and then say 10, 11, 12 years of age, the height starts to tail off. And remember the arrow that indicates the height for parents. And so this child was okay, a little short for parents at an early age, but clearly is dropping off. And that is a cause for concern. So if you are worried that your child is not growing well, and you would, as parents, know that because they're not changing their shoe sizes, the clothes sizes are maybe not changing, you're not having to buy new clothes, and sometimes very often you see other children in the same year in school that they are shooting up and your son or daughter isn't. So do need to start getting a medical opinion if you're not happy about things, okay? And this is very typically, this is a young person, they get really bothered. And this is something that the doctors will often do. They check the hand x-ray. And the reason to do a hand x-ray is that gives you a notion about bone age. Now, your age is your age, but by looking at the bones, and you can see that some of the bones appear to be broken. They're not really broken. What it means that there is a growth plate at the ends of the bones, and they keep children growing. But you can actually look at all of these bones around the wrist and hand and make an estimate of the age at which the body thinks it is. So some children have a younger body age. So if a child is not growing and is a bit short, and is wearing for 14 years cloth sizes that are, say, 10 or 11 years, often you'll see that the bone age is about 10 or 11 years. So the body feels that this boy here in the picture is a bit young. And that's often what is helpful for us as endocrinologists to understand that there is a degree of bone age delay. It's not concerning. It is what we call variation of normal. There is a term we use called constitutional delay of growth in puberty, and we will often reassure, watch and wait, and sometimes, though, if the child is very, very concerned, we will give a little testosterone. So testosterone is a hormone that boys produce, girls also do, by the way, but in a boy, we'll give a little dose of testosterone to push along puberty. This is, by the way, it's an orchidometer. It's not a necklace that you wear around your neck, but it's helpful to work out what the size of the testicle is. And that's quite important for us as doctors to know. These have numbers on them, and what number your child is getting up to tells us about the stage of puberty. Of course, that also means that the child has to be examined, and something that maybe before your clinic visit, talk to your son or your daughter that we might need a examination, and do you need a chaperone, or are you comfortable with that? And if you're not comfortable with that, okay, we can draw some pictures, but we can work with a young person. We don't want to impose anything because it can be a little sensitive. I mentioned this condition called constitutional delay of growth in puberty. It is relatively common in boys, will improve on its own. And if it doesn't improve, we can push along puberty, but there is a catch. And the catch is sometimes this same delayed growth and puberty can also present with a brain tumor. So what I'm showing here on this slide, on the left side is a normal brain scan, and this arrow shows the region where the pituitary gland is. And here, this is, you can see the contrast between what looks like a normal gland, gray in the front and white at the back, to becoming a bit of a blob, and that is a very typical finding for something called a craniopharyngioma. It's a slow-growing tumor, and this is coming, remember the term hypothalamus? It's coming from the hypothalamus. It's benign, but it does grow over a long period of time, but it is in a difficult area of the brain. And although it's benign, it's not an easy thing to treat. Having said that, one's treatment has changed over the years. And as an endocrinologist, we would be very happy to replace some of the hormones that are missing because of the position. So this tumor, by its position and pressing on some of the structures around it, will very likely cause pituitary hormone deficiency. So this child will have growth hormone deficiency, may have water hormone deficiencies, and some of the other hormones that control some glands, which we can talk about later on. Essentially, if your child has something like this, and please feel free to ask, because every individual has a different need and outcome. But these are treated very well. Often you'll need hormonal endocrine follow-up over a long period of time. So here is where we come in. Helen will often meet up with our families and give them lots of advice. Now, we'll switch tack a little bit from being short. This is a child who's unusually tall. You can see that the lines are well above the tall centile lines. Now, what you see here is the parents' height here in this black dot. The parents are also quite tall, and that's what is called constitutional tall stature. Some parents come to us and say, my child is too tall, can you do something? And we'll say, just wait and see. Hopefully it'll just be like yourselves. You're tall, your child's also tall, and therefore treatment is not usually required. There are some conditions where you're very tall and you are getting taller, and in which case we may sometimes limit height. But I'll come to that in a second. This is one scenario that you see red dots. The child was growing maybe just a little below average. So the black line is the average line. You can see the child is starting to creep upwards and is growing actually quite tall. Now, this child is 6 and 7 years of age, so children don't suddenly change course unless something has happened. And what has happened here is another type of growth. It's not quite a tumor, but it is a growth in the hypothalamus, and it's called a hypothalamic hamartoma. So it's benign, it's not a tumor, but it's a growth that has been there and has been growing very, very slowly over a long period of time. But this may give the child early puberty. Now, if you have a hamartoma, you're not going to do anything. Usually, you just treat or pause puberty. But in some children, it may not be as benign. You may get other types of tumors, and in this case, it's called a germ cell tumor. So if your child has something like this, unusual appearance on the brain scan, your endocrinologist may actually ask the neurosurgeons or maybe ask the oncologist, the cancer people, to have a look and have a discussion with yourself. Okay, importantly, boys, they don't go into puberty relatively early. Girls often go into puberty early. That's not uncommon, but boys don't. And therefore, one important thing for us as clinicians is if a child is a boy going into early puberty, we always think of a brain tumor. So we will always have a low threshold to do a brain scan. Okay. So forget a brain tumor. If the child has, as I was saying, maybe a hamartoma, the child is growing well, you just pause, the puberty goes away. But in some children who are growing for a longer period of time, and maybe their parents are very tall, and they're worried that their son or daughter is getting rather too tall, and they need to limit height. This is something that we sometimes ask our surgeons, orthopedic surgeons, to do. So this is called needling the growth plate. So I showed you the growth plate, which was like an opening between the ends of the bones. And here we put a needle, and that irritates the growth plate. And as a consequence of that, the growth plate then joins up, your child doesn't grow. It's not very commonly done, but it's something just to bear in mind. If you have very tall children, then that's one option to do. It looks a bit gruesome, but it's a day case and it's done under a local anesthetic. I don't do it, the surgeons do. Okay, so this is another scenario. This is a much younger child. You can see on the growth chart, the parents' heights are up there, so they are of an average height. The child actually started with a low growth on the charts, and age, say 5, 6, is starting to drop off even further. And children, as I was saying, grow. They are not going to be static like this, and static growth is a worry. This is a normal pituitary, remember, front part, and the back part. The front part is called anterior pituitary, the back part is called the posterior pituitary. Here, this child has an unusual pituitary. The pituitary front part, the anterior pituitary, is almost not there. It's really flattened and is, oops, you can see that there is hardly any pituitary gland in the front, and the back part is not there in the normal position. It's gone up, and that's the white back part of the posterior pituitary sitting very high up. And that's something called a combination of small anterior pituitary and an ectopic meaning it's in an odd place. And that's almost likely to give you growth hormone deficiency, and in fact, other hormone deficiencies. And these are what we were saying, there are many other hormones that the pituitary glands make. But two things I would like you to take away. If you have deficiency in the pituitary hormones, the two things, this is a cartoon of the kidneys. On top of the kidneys are little caps called adrenal glands. And the brain makes the hormone called ACTH, which then drives these adrenal glands. So the brain, the pituitary gland, makes this hormone called cortisol from the adrenal gland. It's a hormone that is really important for fighting stress. So if you don't have cortisol, then you can't fight stress, and therefore you become very unwell very quickly. That's one really important hormone I'd like you to remember. The other hormone to remember is, remember, water. So this posterior pituitary, the gland in the back, makes this hormone called AVP, okay, also called vasopressin. And this is a water hormone. So when you make this hormone, you hold back water. So if you don't have that hormone, you will constantly pee out water and you'll be very thirsty and want to drink more. So you drink more, pee more, and it's not a very nice cycle to be in. So remember those hormones, because those are really, really important. If you have growth hormone deficiency, okay, nothing is going to happen in a day or two, but if you don't have the stress hormone, this cortisol, or the water hormone, vasopressin, then you can become very ill very quickly. Okay, and talking about adrenal insufficiency, I'm going to bring in Helen in a second, but it's very easy to treat, and Pituitary Foundation does a lot of awareness raising because this is such an important thing. Kids are kids, they will play around, dance and be messy and all sorts of things, but they should be. I mean, there's nothing that stops them from doing. However, if they're not taking their medicines, they're at risk of having what we call an adrenal crisis. They become very unwell very quickly, go into the hospital, have very low sugars, and get dehydrated. So it's really important that we make sure that they take their medicines, either tablets or medications. And this is where Helen will come in to show you a little bit about her role, because she advises these families on what are called sick day. So if you're ill, you normally should be making a little bit more of the cortisol. And if you're unwell, and you're not being able to take your medicines, what happens? Because you then have to give it by a different route, and this is where the injection comes in. Okay, so I'm going to move you to Helen, if you could take over.
Hi everyone. So my slide just sort of goes through what we provide families with here at Manchester in regards to teaching and training about hydrocortisone, sick day rules, and the emergency injection. So what we tend to do is we will bring you to a nurse-led clinic where we will discuss obviously the importance of the steroids, taking them regularly, why the child is on them, and then we'll discuss sick day rules about when to increase the hydrocortisone, how long for, and we provide you with an adrenal pack that basically contains lots of information from the BSPED website. I've just put the QR code there on the slide. So we'll provide you with lots of information to follow in regards to when to give the sick day, how long for. We also provide you with a video that we made here at Manchester, which demonstrates how to give the hydrocortisone injection. So when you come to clinic to see us, you will practice drawing that injection up and giving it to a dummy model. But we also provide you with this video. So for both the powdered hydrocortisone and the pre-made hydrocortisone, we've done a video that basically demonstrates how to draw it up and give it. And we'll provide you step-by-step instructions as well on how to administer this injection. So we go through all of that in clinic. And like I said, we provide you with an adrenal kit that has all your needles, your syringes in, your steroid treatment cards and all your information. And then we also discuss about school as well, and providing information for school around understanding the medication that they're administering, because a lot of schools will be giving the lunchtime doses of medication. So it's really important for them to understand what they're giving, why, and the signs and symptoms if a child is unwell and who they need to be contacting, and about the extra medication and why they also hold an emergency injection at school, because that is important as well. That here at Manchester, we don't train schools how to give the emergency injection, so teachers won't be trained on how to administer it, but we ask that they hold a kit at school, and that's simply to give to a parent or a paramedic, but they still need to understand scenarios of when that would need to be administered and the importance of it. So we provide lots of training around that in the clinic, and then obviously you take all your information at home and you've got lots of refreshers and things to look at. And if ever you wanted updates and things like that, that's what we're here for. We have we see patients regularly in clinic that will come in, and we provide updates on all of this, because it is a lot of information to take in. So obviously processing it and going over it helps you understand it a bit better.
Well, thanks, Helen. I just also wondered whether some of our younger people, so teenagers, because it's such an important time, and they have been, when they were younger, their parents had brought them to clinic, and now they're starting to understand afresh what their condition is. They often will need a refresher, and that's what sometimes you do, Helen, don't you? You actually teach the young people about their condition, sick day rules, and the injections, how to give injections themselves.
Yeah, absolutely. If the children, if the young adults want to come in and practice doing it themselves, because you're right, it'll get to a stage where they need to take a little bit more responsibility for their medication and their health. And them practicing being able to give this injection is really important, especially to build their confidence up if they ever had to give it themselves. So yeah, we provide training for the older children as well.
Oh, thanks, Helen. And just also to say that it's very easy for us as medics and nurses to tell parents that you should be giving your child an injection, but this is not an easy thing to do. But the more information you have, the more you see the videos and maybe practice on dummies and situation, be ready for a situation, and hopefully that situation will never arise, but it's always good to be ready and practiced, wouldn't you agree? Okay, so I think we will pause there if there are questions, and I will maybe back to Emma.
Thank you, Indi. Thanks, Helen.